Stress? Never heard of it.
Can we just go? Come on.
Today we're checking out another animated classic from the Cartoon Network. It's called Regular Show. Now, to be honest, this is the first time I'm watching and reacting to Regular Show, but evidently it's about two best friends who try to turn their regular, boring jobs into exciting adventures. I'm not sure exactly what that means, but it sounds super interesting for sure. Plus, we're going to be learning about and breaking down some of the crazy medical type situations and possible injuries that happen in this show. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an emergency room doctor. If you enjoy the educational reaction videos and other stuff you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
Dude, you're allergic to eggs?
I thought if I ate really fast, maybe I wouldn't notice.
Rigby?
What? Allergic reactions can cause cardiac arrest in different settings. What ends up happening is when you have an allergic reaction, you're basically having a type of shock because you're having dilation of your blood vessels, but what's also happening is swelling. So you can have airway compromise. So then you can cut off your own airway, not get oxygen in, decrease oxygen to the heart tissue will stop beating.
Wake up!
Get back! Punch it, we're losing them!
Go. Yep, there's the side bench. At that point, you need to lower the bed down, get it flat. Typically, you need a hard surface underneath, not just the bed because it's going to be too much cushion. Now we're at the hospital.
Your friend Rigby's in a coma because of an allergic reaction his body had to the eggs.
Oh.
Fortunately, due to the large quantity of eggs that he consumed, there's a strong chance that he may never wake up again.
So then the question is, are they in a coma that's induced by medications that we do a lot at the hospital versus is it because of the event that happened and usually because of decreased oxygen to the brain?
Is there anything we can do?
All we can do is wait.
So the doctor's right. Nobody wants to hear that. But as I just said, in somebody in this situation, you just have to have time to allow it to see what happens and does the patient recover or not. There's not any medication or treatment that you can do to then kind of wake somebody up out of a coma if it is due to decreased oxygenation to the brain.
Stress test machine. I always ace these things. You know who else always aces these things? My
Wait a minute. This is like a portable stress test machine. Typically a stress test that we do at the hospital, the cardiologist does it. It's a cardiac stress test where basically they're trying to induce any ischemia or injury that could happen due to higher demand on your heart.
Stress.
Oh gosh. Okay, it's you.
Suggestion. Cut back on the late night pies.
Oh, what?
Oh, cool. So it tells you how stressful you might be. There's good stress, there's eustress, there's distress. What ends up happening is stress can cause increased blood pressure, which then can cause increased demand on your blood vessels, hardening them, which then could potentially cause more cardiovascular events. My advice is do everything you possibly can to de-stress, figure out what your triggers are.
Yeah, Skips, what made you so stressed?
Look, I'm fine. Can we just go?
No, I'm afraid you're not fine. Now, may I?
What is that?
These are indicators of severe stress.
So I don't know if they're trying to describe like a vein disease or abnormality of the veins relating to stress.
Let him breathe. He's not breathing.
Not breathing. By standards, call 911. Look for a defibrillator. These are the things you need to do. Multiple people could help in this situation. One could do airway if there's a barrier that you can use, or just hands-only CPR. But after a 2-minute round, you need somebody else to take over for you because you get tired. Somebody with fresh body, basically, to be able to pump really hard for this person because you're doing it 100 times a minute, or at least at that rate.
He's gone.
And you would not call it that fast. And who's calling it? This is a ghost. So, okay, maybe the ghost has special power. Typically, if somebody has a witnessed cardiac arrest, you work hard to get that person to be revived and bring them back. And then basically get them to the hospital ASAP so they can have advanced care, intubations, other medications that we can use.
You killed my best friend! We're sorry!
Yeah, we didn't mean it!
Got you, dude.
Oh, and the patient's alive.
Best prank ever.
That's so messed up. Sometimes people will fake being unresponsive. It's really hard to fake being dead.
Every day I have one for breakfast, lunch, and dinner. I've never felt better.
Oh, jeez.
My stomach.
Oh.
Yep. You definitely need a stomach transplant.
What?
What? Stomach transplants, typically a doctor will just actually make a new stomach for you using the first part of your small intestine. It won't digest as well and you'll probably not absorb as many of the nutrients that you normally would, but still function, you can still eat, that sort of thing.
Scratch that. You had a completely normal reaction to an extremely unhealthy sandwich. Then your stomach flat out exploded. You see?
Whoa! When they say the stomach exploded, most likely what happened is a basically perforation of the stomach wall, which can happen. The bowel is just a general term that we use for any part of your gastrointestinal tract. But what ends up happening is then you get free air in your abdomen and you need surgery to close it and make sure there's no infection, that sort of thing. It's actually an emergency.
Can you put him on the transplant list?
Well, yes, normally you'd be able to, but a man of your physical gifts would burn through a normal stomach like it was nothing.
Spell it out for me, Doc.
You're too,
Oh my gosh.
how do I put this delicately?
Hey!
Oh, come on.
That's just wrong.
Not cool, man.
Well, you're too weak to be moved, and we need a suitable transplant or you'll die.
What? But he is correct. Time is of the essence. If you continue to have that type of foreign material within the abdominal cavity outside of the gastrointestinal tract, you will get infected, you'll have sepsis, and then you could succumb to the infection that's in there.
You too, Mr. Smith.
Hey,
Oh my gosh.
Frank.
Thank you, Frank.
Oh, whoa, see? They didn't even know it. They landed in a pool. That's gotta hurt. Sometimes hitting water is still hitting concrete. Question is, could this actually be beneficial to helping you survive? I guess it's better than hitting the concrete that's next to it, but how much does it actually take off?
They be all right, Doctor?
Oh, they'll be fine. If that handshake hadn't broken their fall, they'd be dead. We'll be able to separate them in about 6 weeks.
What? So nobody gets full body casts like that. You see it in TV shows, you see it in movies where people are walking around in these full body casts. No, that doesn't happen. You do individual parts, that way you can move, still have function. The only time you really get like fixed is like a halo when you have a cervical fracture and the neurosurgeon literally screws in this apparatus to your skull. This was really funny. So I've never seen the regular show, but the medical scenes that are a part of this are actually pretty hilarious. Let me know in the comments if you want me to do another one, because I want to do another one. So if you guys like it, let me know. Do you have a favorite TV show or movie that features medical situations that you want me to break down further and explain? Let me know which show or episodes in the comments below, or if I missed any regular show scenes that I should check out for another video. As always, make sure you subscribe and turn your bell notifications on if you want to see more fun videos like this one. And check out my Doctor Reaction series right here to catch up on reviews of your favorite TV shows. Thank you so much for watching, and stay healthy, my friends.